Hello everyone, my name is Liu Xinyi. Today, the item for my presentation is Digital Strategic Communication for Hospital Marketing with Chongqing Longdu Hospital Medical Magazine as a typical example. Now, I will begin my presentation. With the intensification of the competition in the medical industry and the increasing diversification of the medical pattern, it has become an important issue for hospital managers to enhance the brand influence, expand market share, and cultivate customer loyalty. Public relations, advertising, and marketing activities become three powerful marketing tools for hospitals. Now, many hospitals begin to pay attention to the news activities, using the news media platform to improve the importance of the hospital's popularity and reputation and reduce the negative impact. So they succeed. The establishment of the public relations stage, elaborate planning, the launch of event marketing with the public relations at the core, and the full use of the role of media promotion, widely and effectively establish and strengthen the hospital's brand image. Improve the brand is an absolute shortcut to profit. I choose the medical magazine published by Chongqing Longdu Hospital because most hospitals in China have similar marketing methods. So I think Chongqing Longdu Hospital has certain representative and good research value. In the era of information explosion with high development of the internet, the audience is surrounded by massive information, so the advertising marketing becomes more and more inattentive, and attention becomes a scarce resource. In the fair competition, whoever wins the attention of the audience will be able to obtain the considerable share of the audience in the market. Attention marketing originated from the attention economy proposed by American scholar Michael Goldhaber. According to the attention economy theory, the marketing communication activity of enterprises should focus on how to earn attention. In the network marketing communication of private hospitals, all hospitals pay great attention to the construction of the official website of the hospital's PC terminals, especially the Baidu bidding page in the official website. In order to win the click rate of patients, the number of views and the users stay on the page viscosity to get the patient's attention. In the advertising and marketing communication of offline paper magazines, private hospitals focus on operating price, content planning, picture design, and magazine arrangement in order to get the attention of patients. Therefore, advertisers need to seek media further through media means to promote and market their own goods. In the way of private advertisement marketing, private hospitals usually print medical magazines by themselves, publish advertising and marketing contents with the help of such media as magazines, and distribute medical magazines to the audience for free, so as to obtain the attention of the audience, so as to obtain the patients who come to see the doctor through the magazine. Chongqing Longdu Hospital set up the planning department to plan medical magazines and began to distribute the first batch of medical magazines in December of 2014. It is common for medical magazines to have sections of articles that contain entertaining content, and the number of such sections in medical magazines varies from magazine to magazine. This part of the content is mainly emotional stories, life knowledge, science and joke articles, and combined with the real-time hot topics of the month, as well as the current concerns of the audience to attract the audience to read. In order to get more audience to pay attention to the magazine content and read. The goals of the campaign is after 2015, the number of printed copies per month reached 300,000, and the medical magazine transformed patients into 3 parts per 10,000. And the media executions are in the advertisement marketing communication of the medical magazines. The low price of seeing a doctor is one of the main characteristics of the advertisement marketing of Chongqing Longdu Hospital. There are 2 main ways of marketing within the magazine. One way is to attract patients to the hospital through a certain festival or a certain theme of the season as an advertising planning point in the name of holding activities to carry out low-price promotion. Another way is to attract patients to see a doctor by directly promoting the treatment technology needed for a specific disease. And the medical magazines of Chongqing Longdu Hospital are mainly divided into 2 types: obstetrics and gynecology magazines and men's medical magazines. The outcomes of the campaign is the advertisement marketing of medical magazine has promoted the development of Chongqing Longdu Hospital, which has gained profits for Chongqing Longdu Hospital to some extent, and also spread the image and brand of the hospital in the market. From the initial exploration of using magazines for advertising marketing in Chongqing Longdu Hospital to the maximization of magazine advertising marketing communication effect, and then to the development of network media and new media and other factors. The marketing communication effect of medical magazines is getting worse day by day. After April 2016, the advertising and marketing effect of medical magazine became very poor, and the magazine basically lost money. Thus, it can be seen that the medical magazine advertisement of Chongqing Longdu Hospital produced economic effect and brought benefits to the hospital during 2015. However, after April 2016, the number of patients visiting the hospital by magazine advertisement has been decreasing. I think it is necessary for the hospital to do an in-depth analysis of marketing environment, because the analysis of hospital marketing environment is a primate for the hospital to do a long-term strategy and marketing planning. The competition of the medical service market is getting more and more intense. If the hospital marketing mix strategies don't match or run counter to the trend, even if it gets the present interests, it also cannot obtain long-term development. The analysis of the marketing environment is essentially the analysis of the marketing opportunities and threats of the hospital. The marketing environment provides equal opportunities for all competitors. How to make use of the marketing environment and seize the opportunities in time to avoid environmental dangers or transform the environmental threats into new marketing opportunities is the key to marketing decisions. Chongqing Longdu Hospital Medical Magazine has caught the reading preference of both men and women. That is, women are more inclined to read stories, while men pay less attention to stories and launch targeted advertisements to spread content. At the same time, to follow the trend of the medical market to adjust the magazine and its advertising marketing. In recent years, private medical magazines have been constantly imitating the design style of fashion magazines. In particular, the cover design of uses the photos of stars as the monthly publicity figures for the cover. For medical magazine cover design of medical magazine to taught are common today. This has become the common situation of medical industry magazine advertising marketing communication. In the magazine also didn't reflect the hospital's human nature, meticulous service. Market positioning is the key to all enterprises and products to be solved first. However, many hospitals now make the same mistake. That is, the positioning is the same or the positioning is vague. There is no clear and unique effective inspiration of other hospitals' point. So I think we should not only improve the service standard, but also enter the sub-health market. The Ministry of Health organizes data to report that only 5% of people are healthy, 20% have disease that require treatment, and most of them, for 75%, are in a state of sub-health. With people's health awareness becoming stronger and stronger, people learn about their physical conditions through physical examination to make prevention as the main treatment as the auxiliary. The medical examination results are interpreted by senior doctors and written health advice is made. If the subject is found to have underlying medical conditions, the hospital will send experts or specialist doctors to help them develop personalized health care and treatment plans to attract a large social group, expand the hospital business, and improve the economic and brand benefits of the hospital. Then we should establish a perfect service system. All kinds of service activities like the marketing strategies of hospitals are always carried out around a center, which is to make customers satisfied, truly reflect patient-centered, improve service quality, standardize service behavior, and improve service attitude. So the hospital should set up a complaint reception desk to receive and deal with patients' complaints. To improve differentiated services, ensure the medical service of the hospital is convenient and quick. By learning IMC and combining with hospital marketing, the following conclusions are made. The first is ground marketing. It includes physical examination, mainly for the organization of group physical examination. It can be divided into rural community schools, enterprises, and institutions. Free diagnosis, health talk, and second is air marketing, telemarketing, SMS platform marketing, network platform marketing. The event marketing include marketing of in-hospital events. For example, the hype of an event in which a recovering patient came to the hospital to express gratitude. Network event marketing, such as the hype of an online medical assistant event, and other event marketing. For example, to highlight public welfare news, scientific can regularly create some events and medical cooperation, hospital image, strength, function, and other marketing. The fourth is experiential marketing. If the hospital introduces some new equipment or carries out some project activity, it can enter the community street to publicize, invite the residents to have free experience, try the effect, make them satisfied, and then achieve the purpose of marketing. The last one is cause marketing. Actively participate in various social public welfare activities or some influential large-scale public welfare activities on their own. Fully demonstrate the positive image of the hospital, social responsibility, medical quality, enterprise culture, to establish a good public impression and reputation of hospital, improve the credibility of reputation, to build hospital brand integrity, to create social benefits to achieve the purpose of marketing. As active ways of hospital marketing, the hospital public relations, advertising, and marketing activities should be organically according to local market competition situation, combined with their own core competitive ability and the historical reality, takes the appropriate marketing strategy can stand out in the local or the similar hospital to build hospital brand.